Now to a Team 10 exclusive, a warning from an East County mother who says a common medical procedure nearly killed her.
The medical nightmare started during a blood transfusion after the delivery of her twins. Investigator Melissa Masiha reveals the horror that unfolded next.
And this is like one of the only photos that I have of them from when they were newborns.
Devin Winchell looks at this photo with mixed emotions. She has beautiful twins, now 8 months old, happy and healthy. But she also sees what she missed, the first 5 weeks of their lives.
I missed every newborn moment. All the bonding, the breastfeeding, the snuggling, the getting up middle of the night, the highs. That was really, really rough.
Devin delivered her twins by C-section in September. She says doctors at UCSD Medical Center told her after the delivery she had low iron levels and needed a transfusion. She says the first bag of blood was fine, the second.
Within 15 to 20 minutes, I started to feel flu-like symptoms, like my body just started to get real achy.
Then it got worse.
I'm just like screaming in pain.
And worse.
Probably within 24 hours, I was on life support. I was in and out of consciousness.
Devin says she ended up in a semi-comatose state, hooked up to machines. When she came to, the news she never expected.
There was something wrong with your blood transfusion. You've been in the hospital now for, sorry, I'm gonna cry. You've been in the hospital now for 5 weeks.
Devin says doctors told her the second bag of blood she got during her transfusion contained the bacteria Pseudomonas.
My blood was poisoned, basically, and it kept attacking the organs.
The bacteria's effects ate away at her skin. The picture's too graphic to show. It attacked her inside and out.
Completely consumed all of the muscle in my abdominal area.
Worse, Devin says doctors told her in a few years she could be wheelchair bound.
Was there any warning about this type of bacteria?
No. Oh gosh, no.
After hearing Devin's story, Team 10 examined blood donation procedures in San Diego County. Donors are tested for these illnesses as required by the FDA. They include hepatitis B and C and HIV. I asked the FDA why Pseudomonas isn't on the list. A spokesperson said it is not considered a major risk. Devin says she's proof it is.
How many patients do you want to kill or maim or disable?
Devin and her family want to bring awareness about risks when it comes to blood donations and transfusions.
They should be testing this stuff before it goes into patients. If this would have happened to like a cancer patient or someone who is elderly or a kid, it would have been catastrophic. I guarantee you it would have been fatal.
A spokesman told Team 10 UCSD Health performed every mandated FDA test prior to starting Devin's blood transfusion, and the blood bag also passed a visual inspection. He says doctors halted the transfusion as soon as things started to go wrong.
Wow. Where does the hospital get its blood?
Well, the American Red Cross is the primary blood provider for UCSD. They wouldn't comment, citing confidentiality. Now, it is extremely rare for bacteria to be transmitted during a transfusion. The most recent FDA statistics show 1 death in 65 million units of blood transfusions.
We know you'll stay on it. Thanks, Melissa. Team 10